Hi, my name is Michelle Plyler. I'm a certified nurse midwife here at County OB/GYN. Today I'm going to be discussing what to expect at your first gynecological visit. Like many young women, you may be nervous or uncertain about what will happen the first time you come for a GYN visit. You might choose to come alone, or you may decide to bring someone with you, your mother, a sister, a friend. We can make time to talk along with you in case there are issues that you don't feel comfortable discussing with your support person. Depending on several factors which I will discuss, you may or may not need a pelvic exam the first time you come for a visit. At your first visit, we'll sit and talk about your medical history and your family medical history. We'll go over any gynecological concerns or questions that you may have. We'll talk about contraceptive or birth control options. Many young women choose to use contraception for things other than birth control. These contraceptive methods can help to control your menses so that they're not as heavy, they're not as painful, and they can alleviate acne and PMS symptoms as well. After the discussion part of the visit, we'll move on to the physical exam. The first part of the physical exam is basically what would have been done when you go see your pediatrician every year for an annual exam, with the addition of a breast exam. If you're not sexually active and you're under 21 years old, most likely you will not need a pelvic exam. Testing for gonorrhea and chlamydia, which are the most common sexually transmitted infections, begins once a woman is sexually active and is done each year at your annual visit until 25 years old, and it can be done more often than that for specific concerns. The pap smear, which is a screening test for cervical cancer, begins when a woman is 21 years old. If a pelvic exam is needed, you will be lying down on the exam table, you'll have your feet in the footrest, and you'll have a drape to cover your lower body. The pelvic exam has two parts. The first part of the exam is done with a speculum. This is a speculum. For the exam, I'll have gloves on my fingers, and I will put lots of lubricant on the speculum. I'll place the speculum into the vagina, and I open the speculum up about this much. I'm looking for the cervix on the other side, which looks like a small bagel or a donut. Then I'll take samples. If gonorrhea and chlamydia samples need to be taken, I'll take a small Q-tip and place that into your cervix. It stays in for 20 seconds. If a pap smear needs to be done, I'll take a small brush and go around the outside part of the cervix, and then another small brush that goes inside the cervix. Once the specimens have been taken, the speculum will come out. You might feel some pressure with the exam, and it might feel awkward. It should not be painful. The next part of the exam is called a bimanual exam. I'll place a generous amount of lubricant on my gloved fingers. I'll place 2 fingers into the vagina. My other hand will go on the abdomen. I'm feeling for the cervix and the uterus, then on each side for the ovaries to make sure that everything feels normal. Then I'll take my fingers out. You can sit up. The pelvic exam is over. The entire pelvic exam takes just a matter of minutes. At County OB/GYN, we want your first visit to be as welcoming and stress-free as possible. We'll explain everything that is happening, and we'll give you as much time as you need to go over any questions or concerns that you have. If a pelvic exam is needed and you feel that you're just too nervous or scared to do the pelvic exam, you can come in and we can talk, and then you can come back when you feel comfortable with doing the pelvic exam. We want your first visit to be as comfortable as possible. My name is Michelle Plyler. I'm a certified nurse midwife, and I look forward to meeting you here at County OB/GYN.